Hi everyone, thanks for listening to my presentations. Today I'll be talking about Indinavir kidney stone. If you have checked my channel, you would have seen some presentations on kidney stones. But today I will be limiting myself to Indinavir kidney stone alone. Okay, sit back and find out why is this kidney stone different from the rest. Let's go. Okay, we're talking about Indinavir kidney stone, but we need to know more about Indinavir on its own. Indinavir is a kind of medication used to treat HIV patients. So it is known as Indinavir sulfate, a protease inhibitor for the treatment of HIV infection and also in AIDS. The effects of Indinavir will be the following. There will be increase in CD4 counts, low HIV titers, and it is excreted via the kidney system, and it is high in the urinary excretion. It is having low solubility in the urine. Therefore, the probability of forming Indinavir urolithiasis, called Indinavir stones, is very high. Indinavir stones could be a mixture of stones. For example, it could be a mixture of Indinavir and calcium oxalate. Note this, all the diagnostic measures, plain abdominal x-ray and so on, will pick many of the kidney stones, right? CT is the best to pick all kidney stones, right? But will not pick Indinavir stone. How then do we go about making the diagnosis? You do regular urinalysis once your patient is on Indinavir, anti-HIV medication, and you'll be checking for Indinavir crystalluria. So you'll be checking for the cloudiness of the urine due to crystals, and that will be an indication of possible stones or cystinuria. Refer to nephrologists who will be able to take appropriate measures by supplying him or her with a full history of Indinavir being used by this patient. Treatment. In case you are in a rural area or you are just far from the center where appropriate stuff could be done, if it's not an emergency, then you can do some stuff. But if it's an emergency, you have to have emergency drainage in the face of a severe obstruction. But if that is not the case, then hydrate generously. Give analgesics, the painkillers. Still on treatment, you can discontinue the medication for a while, but it's difficult to take the medication away completely from HIV-infected people or people down with AIDS already. However, in 25% of cases, you have to discontinue the medication completely. You can have a meaningful conversation with the expert handling the case. Spasmo analgesic agents like Pramimverin combined with metamizole will be a good combination. That is very good in renal urethral stones and biliary colic. You can administer ureteroscopy or percutaneous nephrolithotomy. You may give double J stent and increase diuresis. Also helpful will be urinary acidification. Embrace and dig deeper. Since it is a good medication for HIV/AIDS, we should not shy away from the full fast. That is, it's a good medication, but then we'll be dealing with stones. Rather, what are we going to do? We should embrace this medication, dig deeper into knowing more, and help the patient out the more. But to avoid this stress, you can use another protease inhibitor entirely and still going for the same desired purpose and outcome. And with that, I've come to the end of this short presentation. Kindly remember to share, and you are free to leave comments. I'll see you again. Thank you.